Hello. Happy Juneteenth. I am Dr. DeShawn Taylor, founder and CEO of Health Justice MD. I help organizations apply a justice lens to their work in reproductive health and rights. I am dedicated to ensuring that everyone has access to the reproductive health services they need to make informed decisions about their bodies and their lives. I'm coming on today because I'm reflecting on the importance of today. What is significant about June 19th? The Emancipation Proclamation issued by President Abraham Lincoln January 1st, 1863, declared freedom for enslaved people in Confederate states. However, it took over 2 years for the news to reach enslaved Black people in Galveston, Texas. Today, we celebrate the actual end of slavery in the United States. When June 19th, 1865, Union soldiers went to Galveston and announced the end of slavery, effectively emancipating the remaining enslaved Black people in Texas. And the freed people in Texas called this day Juneteenth, a combination of June and 19th. That day, approximately 250,000 Black people still held in bondage in Texas were freed. Reverend Dr. Martin Luther King said, "Formerly enslaved people were freed to famine." And that really stuck with me. Given no land to cultivate, while European immigrants received land in the West and Midwest, providing an economic base for those families to amass generational wealth. Today, we celebrate the liberation and resilience of Black people, yet we continue to fight for justice. Juneteenth has become an occasion to honor ancestors, recognize their sacrifices, and celebrate the achievements and contributions of Black Americans to this nation. It offers an opportunity to educate and raise awareness about the history of slavery, the struggles endured by Black people, and the ongoing fight against systemic racism. Studying the history of this country is a prerequisite for our progress. The tactics we see today are not new. There is always opposition to progress from the privileged people who benefit from others' oppression. There is always re-entrenchment of ideals and values that serve only a privileged few by maintaining the status quo. In the spirit of Juneteenth, we are called upon to advocate for equality and work towards creating a more just society. And I think ahead to Saturday, June 24th, which is the 1-year anniversary of the Supreme Court Dobbs decision that overturned Roe v. Wade. Now, we begin this week celebrating freedom and liberation with Juneteenth. And the week ends commemorating the loss of freedom for womb-bearing people to make their own decisions about their bodies and their lives, taking our country decades backwards in regards to our reproductive rights. Make no mistake that the ability to control our fertility as people who can experience pregnancy is directly linked to the trajectory of our lives, our families, and our communities. We cannot have health equity without addressing the legacy of the historical abuses against communities of color in the United States that created the conditions for the health disparities that we see today. The American chattel slavery system relied on the forced labor and reproduction of enslaved Black women. Since the forced arrival in America, Black women have been stripped of the agency to decide if, when, and how to have families and raise children. Freeing enslaved Black people without providing economic opportunity. Bombing and mass murders of communities that had the audacity to somehow still prosper. Eugenical contraceptive practices. Social and political disenfranchisement. We see the legacy of all of this embodied in the communities most harmed by policies that restrict access to care for the full range of reproductive outcomes, including abortion. 40% of abortion seekers in the United States are Black. Black birthing people are 3 to 4 times more likely to die of pregnancy-related issues compared to white women. Black birthing people are also at increased risk for criminalization for pregnancy outcomes. The fight for racial justice and reproductive justice are intertwined. The policies that have decimated access and criminalized abortion is most felt by Black people. There is good news. We can dismantle oppressive policies and institutions. We do not have to stand idly by watching what was hard fought for crumble. But it does require a radical shift in how we advocate for our reproductive health and rights. What worked before will not work now. What got us Roe as a framework does not serve us in creating a bold new future. Deeply understanding our history is required. Examining our relationships, our own relationships with oppressive systems and institutions is required. Evaluating values that we have adopted over the course of our lives that we assimilated without quite interrogating is required. To move beyond the backlash that comes when the powerful fear their demise, we must address systemic inequities that impact marginalized communities and lean in to our power to resist the familiar, thereby maintaining the status quo. Are you ready to shift? Whether you're an organization looking to transform your approach to reproductive health and rights, or you are a social justice organization ready to get involved in the fight for reproductive justice, my mission is to help you build and execute your organization's blueprint for addressing the increasingly complex social issues that this unprecedented moment demands. I founded Health Justice MD at the intersection of my clinical work and social activism. Over 20 years of providing abortion care and working in medically underserved, socioeconomically depressed, and ethnically diverse communities fueled my social and reproductive justice activism. I bring my teaching, relational, and research skills, knowledge, expertise, and leadership to help organizations through a paradigm shift to move beyond today's challenges. Again, I ask, are you ready to shift? Leaving behind the status quo to press forward towards a bold new vision for the future? If so, type shift in the comments. I want to see who my bold new vision leaders are. Thank you for joining me today.